Hello, everyone. The topic of discussion today is dentifrices, their preferences and recommendations. The topic may look simple, but there's a lot more to understand about dentifrices. So when we come across patients, the most frequent question that we encounter is, Doctor, which is the best toothpaste that I can use? The patients are so confused because there are several brands of toothpaste available in India. So namely the Colgate, Pepsodent, Close-Up, Sensodyne. So there are variety of toothpaste. So it is our responsibility to prescribe and recommend proper toothpaste for a patient based on the oral conditions of the patients. So dentifrices are available in different forms: tooth powders, toothpaste, tooth gels. So dense is tooth and fricare is to rub. All of us know about toothpaste, its functions, that it helps for aesthetic reasons, for hygienic reasons. It removes bacteria from the gums and teeth, and it also contains some therapeutic and preventive agents that may help to prevent or treat oral conditions. So, the patient may present with different oral conditions. Say, for example, gingivitis. The patient may have extrinsic stains, calculus, dental caries, or exposed dentin. So, here is the question. Can the same toothpaste be indicated for different oral conditions that we just saw? Are all toothpaste essentially the same? If there are active ingredients, what are its functions in a toothpaste? And are there any adverse effects of these ingredients? So we need to have a general knowledge on all of this. So if we look at the composition of the toothpaste, we have inactive and active ingredients. So mostly the inactive ingredients are more. Say, for example, the abrasives, flavoring agents, sweeteners, preservatives, and coloring agents, they are inactive ingredients. And the active ingredients are the therapeutic agents which may help to prevent caries or gingivitis. So here the next thing is active ingredients are to prevent gingivitis, to prevent caries, to desensitize the teeth. So desensitizing agents, anti-calculus agents are there. And if you look at the composition of dentifrice, abrasives form the bulk of the composition. Say, for example, 40% of a toothpaste is comprised of abrasives. It's so very important, and it cleans and polishes the tooth. And also it removes extrinsic stains. If in a toothpaste the abrasive content is less, then it is ineffective in removing the stains or soft deposits. So if the abrasive content is more, then it may lead to abrasion of the teeth. And the common abrasives that we find in any toothpaste is phosphates, carbonates, or silicates. So here the abrasives is scaled from 1 to 10. So it is most hardness scale with a spectrum of 1 to 10. And the soft mineral is comes at 1 and the hard mineral at 10. So this is compared to the dentin and enamel. So the abrasivity of dentin it is 2 to 2.5, whereas that of enamel is 4 to 5, which means if you use any abrasives less than 2.5, it's safe for the dentin and the enamel. So if it goes beyond 2.5 to 3, the scale of hardness, then it may abrade. Say, for example, 3 calcium carbonate is a 3, so it may abrade the dentin because the hardness of the dentin is only 2 to 2.5. Whereas for enamel, the hardness is 4 to 5. So anything less than 4 will not cause any damage to the enamel, but hydrated silica or calcium pyrophosphate, they are going to warn away the enamel if it is an ingredient of a toothpaste. So fine rounded abrasives are preferred in a toothpaste. So here there is a radioactive dentin abrasivity, which is the unit to measure the abrasivity of any agent. So if it is less than 70, it is a low abrasive. If it is from 70 to 100, it is medium abrasive. And if it is greater than 100, it is highly abrasive. So the ADA recommended limit for the abrasives in the RDA limit is 250, whereas FDA recommended limit is 200. So here are some common brands. I'll read out the values, RDA values of all of them. Like for example, the Colgate Total, the abrasivity or the RDA value is 70. So we just saw like 70 to 100 is safe, that is medium abrasive. So Colgate Total, Sensodyne, all comes that RDA value of abrasive shows that it is a medium abrasive, it contains medium abrasive agent. Whereas when we look at Colgate Herbal, the abrasive or abrasivity or RDA value is 110, which means it is highly abrasive. Okay, so be very careful while prescribing a highly abrasive dentifrice. For Close-Up or Glister by Amway or Pepsodent, RDA value is just 80, which means it is within the recommended limit. Usually the whitening toothpaste, they contain a highly abrasive agent. The reason is it is designed to remove extrinsic stains. For example, Colgate Visible White, the abrasive value or the RDA value is 124, and that of Colgate Total, it is 120 to 150. Colgate Total Whitening is 120 to 125. For Colgate Total Advanced Whitening, it is greater than 180. So when you prescribe whitening toothpaste, be aware of the RDA value of each toothpaste. Okay. So, and also we have to inform the patient. Okay. Otherwise, the patient, if he continues to use the toothpaste at a regular basis, he may end up in having abrasion of his teeth. So the abrasion of teeth is influenced by various factors like brushing frequency, stiffness of the bristles, the pressure applied, and the abrasive agent in the toothpaste. So when we look at teeth whitening dentifrices, we usually prescribe it for patients with extrinsic stains. First, we will look at the etiology of extrinsic stain: smoking, tea, coffee, red wine, or when we prescribe chlorhexidine. So all this may cause discoloration of the tooth. In a toothpaste, there may be some chemical, mechanical agents or chemical agents or enzymes to remove the staining. The mechanical agents are usually the abrasives. The chemical agents are hydrogen peroxide, SLS, pyrophosphates or citrates, and enzyme, it is proteases or peptide. So usually perlite in combination with hydrated silica or carbonates are a part of whitening toothpaste. For example, Pepsodent whitening. So this particular FDA approved toothpaste contains perlite and calcium carbonate, which means they are the abrasives present, and they are present to remove the extrinsic stains. In Colgate Total Whitening, we have hydrated silica and titanium dioxide. Again, it is an ADA approved, that is American Dental Association approved toothpaste for whitening of teeth. So here there are RDA value, as we have seen earlier. Again, RDA value of whitening toothpaste. When you prescribe this Colgate Total Advanced Whitening, so please inform the patient about the consequences and how long to use. All these recommendations we need to inform the patients. The only disadvantage of a mechanical agent is it cleans the labial surfaces, buccal and lingual palatal surfaces, but what is left is the interproximal surface. The interproximal staining cannot be removed effectively by mechanical agent. And also the stained pits and fissures, because the brush is a flat surface that has a flat surface, and it will effectively clean only the flat surfaces, whereas the interproximal staining, that is one of the disadvantage of the usage of mechanical agents in dentifrices. So to overcome that, we also have chemical agents and enzymes in toothpaste. For example, this when you take a Himalaya Sparkling White, it contains protease, peptide, citrates to remove the extrinsic stains. All these are chemical agents or enzymes. And also it contains an abrasive hydrated silica. So sometimes this pyrophosphates also helps in preventing the stain deposition. So in Colgate Visible White, we have this pyrophosphate, which has a strong binding affinity with enamel dentin, and because it has a strong affinity with the tooth structure, it prevents stain deposition. So our topic of interest today was if the patient presents with extrinsic stains, then we are going to prescribe teeth whitening dentifrice. You can prescribe Colgate Total whitening or Pepsodent whitening. Colgate Total is ADA accepted and Pepsodent is FDA accepted. The abrasives present in Colgate Total is hydrated silica and titanium dioxide, whereas in Pepsodent it is perlite and calcium carbonate. So the take-home message is you have to assess the patient's oral condition before recommending a dentifrice to him or her. You should have a thorough knowledge of the active and inactive ingredients present in a toothpaste, and always go for ADA, IDA, or FDA seal of acceptance before making any recommendations. Thank you.